Hi, I'm Dr. Gregory Apsey here in Warren, Michigan. I just would like to speak with you about a topic that's a little touchy with people, and that is root canal therapy. It's something that we offer here at the office. Uh, it's it's one of those procedures that is absolutely necessary. Most people don't want to do it because many people have heard from others, root canals are really just so difficult to go through. I feel that root canal treatment has gotten a lot better with modern advances in the technology that we use in the office. We are able to do root canal treatment much more rapidly, much more accurately, and with far fewer x-rays needed, and the procedure is much easier to take. The issues are root canals are needed when when tooth decay goes too far into the structure of the tooth. If the tooth decay is into the nerve of the tooth, the problem is that the nerve then becomes infected. And usually the tooth becomes very painful, and the only way to deal with that is either to remove the tooth or to remove the nerve. Root canal treatment is the removal of the nerve. Sometimes that nerve tissue is completely dead. Sometimes that nerve tissue is still alive, but it's starting to cause a great deal of pain for the patient. So the way the procedure is done is initially we numb the patient and make sure that they are fully numb before we start any procedure. I then go in and clean out all of the decay and go in and remove the nerve tissue. This procedure can be done in one appointment, but depending on the difficulty and the level of infection in the tooth, sometimes it's required that we do the procedure in 2 visits. So basically what happens is that the entire root canal is cleaned out completely, and we use files, very fine metal files, which go into the tooth. I just did one this morning. And we use some hand files, and we also use rotary files, which are attached to our drill. In between the files, we'll be using a disinfectant in the inside of the root canal. We use 2 different types of disinfectants. One of them is a common bleach, and it's diluted somewhat, but that bleach is a very strong antibacterial. And the idea is that when the root canal is complete, we wish there to be no bacteria left in the root canal system, and once the tooth is then sealed up, the bone at the end of the root can heal, and the tooth can become healthy and comfortable again. There is often some discomfort after the procedure is done. During the procedure, it's just a matter of holding one's mouth open until the procedure is complete. We have ways of helping you with that. We can give you something to bite on, which helps to just so you can rest your jaw while we're working on you. But once the procedure is complete, the tooth is sealed up, then the tooth, if it's a back tooth, the tooth is somewhat weak. And so what we recommend at that point is placing a crown or an onlay over the tooth to protect the structure and to prevent the tooth from fracturing when you're chewing. What we want is for the tooth to be comfortable, for the tooth to be long-lasting, and we want to avoid the breakage of the tooth. So once the crown is complete, the tooth is back to normal and chewing just fine. But as I was saying before, there's often a little bit of discomfort after the procedure. What we usually recommend is that you use an anti-inflammatory medication an hour before the root canal appointment starts, and then thereafter as needed. But usually there's a couple days of discomfort. The actual procedure while you're here is not uncomfortable because you'll be numb, and generally it's the discomfort that people have is a lot less than what they had prior to coming into the office. So it's faster, it's better, it's a way better than ever before. It's a way to save a tooth when it's in that bad condition, and it's available here in my office. Thank you for listening.